Hello everyone, and welcome back to another video for this Addison's web series in my camera. You don't want to be looking at the ceiling. Sorry, you don't want to be looking at the ceiling, you want to look at me. Anyways, this one is tips with a shot kit and how to teach people to give you a shot. Now I will say I'm not a doctor and I'm not a registered nurse, but I'm just basically going to give you tips on how to teach people and what I had a registered nurse tell me. Now, I will say if you need to know how to give a shot or how to teach people to give shots, please just ask your doctor. And I know in the beginning of my Addison's disease, when I first got diagnosed, everybody got sat down. My mother, father, brother, and me, we all sat down at the hospital around a table with this registered nurse, and she sat down and showed us all, even me at 11, 12 years old, she sat everybody down and taught us how to do the shot kit and how to draw up the syringe, where you need to put your shot and everything like that. And she also gave us little tips on how to teach other people. So if you need to know the exact breakdown and everything on how to give a shot, then please tell your doctor, because I'm not about to show you how to do that, but I'm going to tell you my tips on how to teach people the shots, when to teach people the shots, and so on. And this video may run over 10 minutes because I need to really explain it to you. First off, you can ask for extra syringes from the doctor or the pharmacist, and they will gladly give them to you. I have to, at my CVS, pay 10 cents a syringe. My medical doesn't cover it. It's 10 cents. You know, they'll pay for my Cortef vial, but they won't pay for the 10-cent syringe. 10 cents. Who cares? But you can ask for extra syringes for yourself, and sometimes it's good to have a couple extra syringes, because as you're carrying them around, sometimes they will break or become kind of broken down and you'll need a new one. And for showing people, you can have an extra syringe. They're not so iffy about it because diabetic people get loads of syringes all the time. So, alright, tips on how to show people how to give you a shot. You will need a squishy ball of some sort that is absorbent, that you can pinch, because the shot goes in your thigh. So you'll need a squishy ball of some sort. You can use a glass of water to show people how to draw up a syringe. That's how I usually did. That's how I've usually done it. And pretty much just show them how to do it. You know, show them how your doctor's told you to do your shots, because I'm not going to about tell you for legal reasons, but I will just say that pretty much you can show people, and teaching people how to give you a shot is definitely a right and not a privilege. That's how I always feel, and that's my opinion. I and the doctors agree, do not show your kid, even though I was shown, do not 100% fully trust your child on giving themselves a shot until they are about 16 years of age. That's when my doctor said that you could really, truly, fully trust me to go out into the world and, you know, be 100% trusted on giving myself the shot and doing the shot kit. And I was a very mature, very grown-up teenager. I was basically around adults more than I was kids my own age. Always very mature. Even now, I live like an 80-year-old woman more than I do a 21-year-old woman. So I'm very mature for my age. Always have been, but I still suggest that until about 15, 16 years old, you do not trust your child 100% to know and do and give themselves a shot immediately. And with friends, not unless if they're over 18 or 16 and older would I trust, you know, my child's friends, to be honest. You know, you trust them as far as you can throw them. Most people aren't strong enough to throw a child that far, so you know, you're not going to really trust your kids' friends to learn how to do the shots. Now, in the beginning, the people that learned how to do my shots were, of course, mother, father, brother, basically, you know, parents and any siblings. People who took me places a lot, like my mom's friend learned how to do my shots because I was friends with her daughter, and I was at her house a lot. You know, I trusted her to be able to do the shots. And in my opinion, learning teaching someone how to give you a shot is putting your life in their hands and trusting that when it comes down to the wire, they're going to have a cool, calm head to know how to give you a shot. And people will get pissed off if you don't teach them, or they'll get kind of like, well, why don't you trust me? And it's like, well, because I'm putting my life in your hands, and if I don't feel you can handle the situation correctly, I'm not going to teach you how to give me a shot. To me, it's definitely something you teach people once you trust them and once they know you well enough. And I mean, I don't think we taught my uncle for a long time when it came down to teaching, when it came down to it. None of my grandparents know how to give me shots, and that's pretty much for other personal crappy family reasons I won't go into, but I didn't teach my grandparents how to give me shots. One might know how, but the other had no interest in learning. So I really just can't stress enough that it's your body, it's your life, and you're putting it in someone else's hands when you're teaching them how to give you shots, and that's 100% your choice. If they're not happy with it, just tell them this is a new disease to me, and that down the road I may possibly feel more comfortable teaching more people and putting my trust in you, but for right now I'm just going to teach the people who need to know, and just tell them that down the road I may change my mind. Because I got friends who know how to give me shots, and I got friends that do not, because I would not trust them at all. One's a little ditzy, and I just can't trust her. No offense to her, but she's a little ditzy, and I just wouldn't trust her when it really came down to it. The other one has a diabetic mother who takes insulin, and she's more level-headed, and I taught her because I could trust her just a little bit more. So pretty much that's my tips on teaching people how to give you shots. And my opinion too, don't be afraid to just say, you know what, right now I don't feel comfortable with you learning. Even like I said, even if it's a grandparent or somebody close, you know, maybe if you have a child and you just really don't trust your friend, even though she may have kids, if you just don't trust her to do it right, then just be honest and just tell them it's something new, it's scary, and down the road I may change my mind. And one question I've always got from people is, how do I know when to give you the shot? You know, that's one thing my one friend was like, how do I know when to give you the shot, you know? The best thing to tell people is, if I'm awake, I will tell you when I need it, or I can give it to myself, but anytime if I become unresponsive or I pass out, give the shot immediately and call 911. Even if it's something simple as I haven't ate and my blood sugar's low, don't ever think it's a mistake. Unresponsive or passed out, shot immediately and call 911. That's the best thing to tell people, because if you are awake, you can tell them if you do or don't need it, you know. Now, something else I'm going to show you is my shot kit. Now, if you're a guy, I don't know what to tell you. Unless if you're going to carry around a man purse or a fanny pack, I don't really know what to tell you. But as a girl, you can say bye-bye to little purses, because you get to carry, and if you drop it, it's fine, like I just dropped it. But if you are a girl, you're going to want a shot kit, and it's going to be bye-bye little purses. Now, I will say, maybe if you're going out and you've got a little clutch, maybe you want to slip the vial of Band-Aid alcohol wipe and syringe in there. Maybe once in a blue moon and you're not really getting drunk and you can trust that you're not going to drop your purse or hurt it, because this has got padding to it. So if you drop it, you know, it's not breaking anything. You know, if you can trust that you're not gonna, you know, okay, but I really just say there's a lot of cute, really big purses that you can pick up that are really cute, and it's just really bye-bye small purses. And I have a designer purse that I get to use once a year, because any other time you see this, it's not gonna fit. You can buy little cosmetic bags to put it in, or you can buy something bigger. This came with one of my purses, actually. This was in it. Now, in your shot kit, you're going to want your basic syringe. I have two syringes. I have this one, which is a little more common. Then I have the safety one that's kind of like broken apart. Keep a bottle with a label of your most current prescription in your shot kit, so that way they know how much you're getting if you're unresponsive, so on and so forth. And then you want to keep your Solu-Cortef in the box, so that way it doesn't break, and if it jostles around, it's not too bad. And that's why I say it's really not safe to put this stuff in just your plain old purse, because you don't want to have to dig around if emergency happens. You want it to be all right there where you need it, and you don't want it to break in your purse. That's a huge no-no, because the pharmacy is stingy and Nazi about giving you another one of these. They don't mess around with this. They aren't going to take it lightly if you break this. You better have proof if it's broke. If it's past its expiration date, they can see the computer and know you're not lying about that. Dispose of it. If you have drug drop-offs, you can do that, or you could just ask your pharmacy if you could just give it to them to dispose of correctly, but definitely do not flush this down the drain, and do not put this in your trash, and because this is a drug that a lot of people can shoot up and use for a lot of stuff, so definitely guard this very, very well. As well as what you're going to want in your shot kit, and I'm not going to get it all out because it's going to make a mess, it's going to be hard to put it back in, but you're basically going to want Band-Aids, alcohol wipes. I work in a restaurant, so I have basic burn cream in here, basic alcohol wipes to sterilize a wound or to sterilize your Solucor-Tef bottle before you stick your syringe in it. You're just going to want, I have all kinds of different random things in here, gauze, all kinds of stuff. It's basically a first aid kit too. It has Band-Aids and gauze and all kinds of antibacterial wipes, things like that. And something you're going to want to do if you have Addison's disease is you're going to want to print out a paper that says your family doctor, the doctor, your endocrinologist, the hospital you go through, your pharmacy that you go through. You're going to want to put your name, your basic living information, telephone numbers, any allergies that you have. Like, I'm allergic to penicillin sensitive. With Addison's disease, you cannot take aspirin at all, but they'll let you know that with the steroids you can't have aspirin. So you're going to want to put stuff like that on there to let them know. So if you get an emergency, they can pull that kind of information up. Now, I got a little pill holder right here that has like Tums and Midol, some Tylenol. You are going to want to carry the medication that you stress dose with on hand with you, so that way if you need to stress dose while you're out, you can take it. But definitely don't ever leave this in the car. Don't leave this in your purse and leave your purse in the car. Treat your shot kit like an EpiPen. When you need it, it's gotta be there. You know you don't want to leave your EpiPen in the car if you have an allergy of some sort and you're having an allergic reaction. You know you can't run to the car. So think of it as such. It's like an EpiPen. When you need it, it's gotta be there and it's gotta be on hand for you. It's cumbersome, it's annoying, but trust me, this is really the best thing that you can do for your shot kit is to make something up to carry around. And like I said, if you're a man, I don't know what to tell you. You know, I don't know what men do when they have to carry an EpiPen. EpiPens do come with a nice little bag though, and the shot kit doesn't with Addison's disease, but you can find different bags and break it down just to the bare essentials of like an alcohol wipe, syringe, and Solucor-Tef if you want, but I like to carry a first aid kit around because I'm just a girl. I like to be prepared. But really, so it's really good to invest in a cute little bag. This one's kind of ugly, but I don't really care. I'm not much on needing it to be too fancy, but if you want, you can design your own type of bag. They have those like purse designing parties you can get stuff from. You can get like Hello Kitty or something cute like that. So, you know, get a bag to put it in. And one more note with this is you're going to want to make a couple copies of this paper and put one in your wallet, so if something happens, they'll look in your wallet, they'll see it and know what you have and know how to take care of you immediately. And if you do need to use your shot kit, tell them immediately that you need a glucose IV immediately, because that will help keep you hydrated and cared for, and just tell them to basically call your endocrinologist. Because you will find that a lot of medical people don't know what Addison's is or how to take care of it. So that's my tips and how to teach people to give you shot kit, teach people how to give you shots, and basically how to deal with it and what to do. And I hope this really helped you, and thank you for watching, and I'll see you guys in the next video.